Hello, everybody. This is Luis Vargas Aboita, your favorite anatomy uh, technologist. And this video is going to be for any student, incoming, accepted, interested, any HoloAnatomy fan. I'm going to be doing a overview of what it's like to be in our holographic anatomy, our virtual labs. So we're going to go through some slides, kind of give you a pre-lab video, and then hopefully you'll be able to come on campus and get a demo from myself or one of our amazing anatomists. So let's go through this video. Pause at any time to check out the cool features. But here we go. Our first slide here, we're going to have some cool activity where you're going to be dissecting the layers of this person and placing each system in its correct spot, just like I did right there. So you'll be moving, cutting away parts, putting them to their regions, getting the skeleton, pinching, doing this movement, grabbing with both hands, separating it to magnify that skeleton and put it in its supine position. You'll have an activity where you can get this arrow over here and move it and answer this question. Put this arrow to the heart chamber. You have 4, so you're gonna put it to the heart chamber that receives oxygenated blood. So let's see, it should be this one back here. Cool, awesome. So pause at any time. You also have this cool pointer in case you want to point it and ask, oh hey, Dr. Churchill, Dr. Wertu, Dr. Legapelli, what's this right here? You can do that as long as the professor has these menus and hits the reset. Everyone can, sorry, not reset, but they'll have a lock button. So if they unlock it, you're able to check out and move the interactive tools. So next slide, we have the skeletal system with a bunch of labels, right? You can go through these label structures with the anatomist, or you can just look at the ones that are labeled and just really appreciate how intricate our axial and appendicular skeleton are, right? You have questions here if you have the time and you want to kind of test yourself and see what our medical students are doing here. This is kind of what you would do is you would kind of read the question, okay, NOKH, what are those structures, right? And here looks like it's this carpal bone. O looks like it's another carpal bone. K, where's K? It looks like it's a tarsal bone, right? And that's the thing about the software, you're gonna have to move around, come close, right? Zoom in with your headset, and then you'll aim and for that arrow, and then you'll put that arrow where the question or where the answer is, right? So if I like N, then N will be the answer where I will put that arrow right where N is. Kind of like that right there. So my answer is B. Cool. Next slide. The muscular system. Again, really appreciate the highlighted labeled muscles, kind of ask questions, kind of see how the software looks for you. If you like it, if you can really imagine yourself learning this way, then this school, this technology is for you. So more questions. The whole purpose of giving you a slide like this is to really immerse you in the space and put you in the shoes of our medical students and how they're learning with this tool, how they're using it, how they have questions here, that are really testing them to learn, what each of these structures are, right? How they have this, model here that's showing cardiac conduction, right? Showing movement of blood and how the muscle contracts. Um, Having some extra information and image to kind of help you understand what it looks like in a cadaver and how it looks like with this 3D image. Some more questions back there. This one's more about the cardiopulmonary system, but we give you questions about, um, either how the anatomical structure moves, what would happen to its blood supply or vasculature if you were to get punctured or get trauma to that area of the body. So having to know where the structure is, how it looks like, what's its innervation, what's its blood supply, all that stuff is part of the anatomy curriculum. And here we have one of the more rigorous topics, which is the neural block, right? The nervous system. You can see here we have the brain, we have the plexuses. We can move the brain here so we can go into the brain, crazy, huh? And really see some of these spinal tracks, right? Pretty amazing. One side kind of cut in half, and the other side you can really see the area of the brain, the spinal cord there, and even some more questions. Again, when you're here demoing, don't worry about, these questions and having to ask them. I just want you to see what our students go through in our lab days. They have pre-work where they study whatever we're going over in class, and then they're given this video to see the structures. They should kind of have an idea of where they are, and then they'll be using this tool to really move pieces together, interact with the model, right? So here, when we're talking about the layers of the kidney and its protective covers, we have students dissect away these pieces, right? Kind of like this movement of pitching, acting as if you were really holding something, seeing that orange box, and then grabbing away. And now you can see we took layers of the kidney to see it right there. And now we remove this kidney to see some of those renal pyramids and that, internal anatomy. Now we go into the gastrointestinal system where we have some labeling again. We're going to have you remove kind of these layers of peritoneum, right? Because we have this layering to protect our internal organs. And you'll practice that pinching movement. As you can see, it can be difficult, right? You want to do it nice and slow, wait for that box to appear, and then you're going to pinch and move away. So the anatomist will help you understand how this movement works, but your job as a student when you're here is be able to move these layers and kind of dissect away the pieces so you can understand how these organs are protected, the layering that go with it. What is this layering made of? How does it work? Right, very important. Does the specific layering have the vasculature inside of it, or does it serve another function? Right, then we go into the lymphatic system, which is something that a lot of anatomists tell me, we can't really see how detailed this is in the cadaver, but with this software, you can really see how detailed it is, and it's really good, right? It's really detailed, and it's very important when we talk about like sickness, right? The immune system, cancer, we can really feel enlarged lymph nodes in the axillary region or in the cervical region. It's very important to visualize how this lymphatic system kind of circulates within your body, right? So more questions for funsies, right? And then we end off with the reproductive system. We have some male here, and then we'll have some female as well. But that is pretty much all of the slides we have for this interactive session. As we continue, we'll create more slides where we'll have some sort of dissection slide or an escape room slide where you will be picking away layers, identifying those layers, and seeing how they play a role in something like an appendectomy, right? Having to know the landmarks, having to know the structure, the muscles, fascia you're having to peel away, and then finding it in terms of its location. How do clinicians refer to each section of the abdominal region, quadrants, right, or regions? All of this as how we implement our anatomy to procedural anatomy or surgery. We use a tool like this. It's very immersive, but that is all I will show you for today for our pre-lab video. Come check it out at MSOM so you can visualize it with the headset, because it's a completely different view than you kind of watching this video, and I want you to really feel this technology and see if it's for you, for your learning, and for our future patients. So have a great day, and we'll see you here at MSOM.